in the M.pox trap, how M.pox or Monkeypox threatens the world. Copyright NLP Radio Inc. Note: this book is translated and narrated by artificial intelligence, so I apologize in advance for possible mistakes in the pronunciation of words. Introduction. In a world where deep wounds from the global corona epidemic still remain on our bodies and souls, we are facing another challenge: the M.pox virus. If you think that this virus is just a regional problem that has nothing to do with you, I must say that you are very wrong. This book is written for you. For all those who don't want to be surprised and terrified by a global epidemic again. This book is not just a book. Rather, it is a guide, a roadmap for all of us so that we can protect ourselves and our loved ones from this threat with a correct and comprehensive knowledge of this virus. If you want to know how this virus originated, how it is transmitted, and how it can become a major epidemic, do not miss this book. By reading this book, you will become one of the people who not only take care of themselves, but also play an important role in preventing the spread of this disease and preventing it from becoming a global disaster. This book provides information that may one day save your or a loved one's life. If you are looking to protect your life and health from this new threat, and you don't want to see another global pandemic that affects the lives of millions of people, you must read this book. Because awareness is our first and most powerful weapon against any unknown threat. Chapter 1. What is M.pox virus? In a world that is moving forward faster every day and medical science is trying to deal with emerging threats, a new virus has emerged that has not only attracted the attention of researchers and health professionals, but also one of the most important health issues in the world. Has become the virus known as M.pox, is a member of the poxviridae family of viruses and has many similarities to other viruses such as smallpox, but also important differences. Basic knowledge of M.pox virus. M.pox is a virus best known for its association with monkeys. In fact, this virus was first discovered in laboratory monkeys in 1958, hence its name. However, M.pox is not only a problem for animals, but also a serious threat to humans. This virus belongs to the orthopoxvirus family, which includes other viruses such as smallpox and cowpox. M.pox is one of the viruses that can be easily transmitted from animal to human and from human to human due to its genetic structure and also the ways of its transmission. This virus has two different strains, one in Central Africa and the other in West Africa. The Central African strain is usually more dangerous and fatal, while the West African strain usually has milder symptoms and is less fatal. Symptoms and effects of M.pox virus. The initial symptoms of M.pox virus are very similar to other diseases such as influenza. The patient may experience fever, severe headache, muscle pain, and general weakness. These symptoms can be confusing at first, as many other diseases start with the same symptoms. However, what sets M.pox apart from other diseases is the appearance of skin rashes, which usually appear a few days after the initial symptoms. These rashes first appear as small, red spots on the skin, but over time, they turn into fluid-filled blisters. These blisters may spread all over the body, including on the face, hands, feet, and even inside the mouth and eyes. Unlike many other skin conditions, M.pox blisters are painful and may remain for a long time. One of the important points about this disease is its long recovery period. Even after recovery from the initial symptoms, the patient may struggle for weeks or even months with residual effects of the disease, such as deep, painful sores on the skin. These wounds are not only physically annoying, but they can also have devastating effects psychologically. Comparison with other viruses. One of the questions that may arise in the minds of many people is why M.pox should be important to us. Why this virus, which at first seems to be common only in animals, has now become one of the world's health concerns. The answer to this question lies in the special nature of this virus. Although M.pox has similarities to viruses such as smallpox, it also has important differences. Smallpox, considered one of the deadliest diseases in human history, was successfully eradicated by mass vaccination in the late 20th century. But M.pox, despite the genetic similarities, is not easily controlled due to the difference in the ways of transmission and the human body's reactions to it. One of the important features of M.pox is that, unlike smallpox, which was only transmitted from person to person, M.pox can be transmitted from animals to humans and from humans to humans. This means that even if we can control human-to-human transmission, it can still be transmitted from animals to humans, which is one of the factors that make the virus difficult to control. Why should we worry? M.pox should be considered a serious threat not only because of its symptoms and physical effects, but also because of its potential to cause a major global epidemic, due to its recent outbreak in different regions of the world, which clearly shows that this virus is no longer limited to African regions. The importance of awareness and preparation against it has become more apparent. Despite the fact that M.pox is not as contagious as the coronavirus, this virus can also spread at a relatively high speed in communities, especially in situations where people are not aware of its initial symptoms and cannot act in time. The virus may spread rapidly in populations with poor hygiene, making it more difficult to control and contain. By fully understanding this virus and how to deal with it, we can protect ourselves and society from its potential threats and prevent a new and devastating epidemic from occurring. In the rest of this book, stay with us to examine this issue in a deeper and more specialized way. Awareness is the first and most important step in dealing with any disease, and this book will help you equip yourself with what you need. Chapter 2. The history of the M.pox virus. The history of M.pox virus, like many other viruses, was initially one of ignorance and confusion. This virus, which was first detected in a laboratory in Denmark in 1958, attracted the attention of scientists, but at that time, no one could have predicted that one day this virus would become a global concern. First identification. In the late 1950s, researchers were studying laboratory monkeys when they suddenly came across a disease that closely resembled smallpox. The monkeys, which were used as test subjects for research on other diseases, suddenly developed symptoms such as fever, skin rashes, and general weakness. These symptoms were so similar to smallpox that at first researchers thought they encountered a new type of the disease. However, further tests revealed that the disease was different. The virus that infected the monkeys was clearly different from the smallpox virus, and scientists named this new virus M.pox. It was named after the initial outbreak of the virus in monkeys, but M.pox soon proved that its range of victims extended beyond monkeys. First human cases. Only a few years after this virus was identified in monkeys, its first human case was reported in 1970 in the Democratic Republic of Congo. This country, which at that time was struggling with many problems, including war and poverty, was a suitable environment for the spread of emerging viruses. The first human patient was a 9-year-old child who lived in a rural area and had severe fever, headache, and skin rashes. Further investigations revealed that the child had no direct contact with the monkeys, but probably contracted the disease through one of the wild animals in the area. This first human case of M.pox showed that the virus could be transmitted from animals to humans, an indication of its dangerous potential to cause a pandemic. The spread of the virus in Africa. After the first human case, similar cases were reported in other Central and West African countries. The countries of Nigeria, Cameroon, and the Central African Republic gradually witnessed the emergence of cases of this disease, which continued sporadically but continuously. In these areas, many people were quickly infected with M. pox due to poverty and ignorance of the symptoms and ways of transmission of this disease. The virus, which was more common in rural and forested areas, was easily spread due to close contact between people and wild animals as well as poor sanitary conditions. In these areas, hunting and consumption of wild animal meat was common, and this issue itself was one of the main causes of M.pox virus spread. However, due to geographical dispersion and limited health infrastructure in these areas, M.pox cases often remained localized, preventing its spread to urban and densely populated areas. Primary studies and research. During the 1970s and 1980s, researchers took a closer look at this virus. One of the key points that was identified during this period was the existence of two different strains of M.pox virus. The strain prevalent in Central Africa was far more lethal and dangerous than the strain found in West Africa. This difference in the severity of the disease made researchers more interested in why and how this virus can appear in different forms. During this period, global health organizations, including the World Health Organization, WHO, began to monitor the spread of the virus more closely. However, due to financial and technological limitations, it was not possible to fully track and control this virus, and many cases of M.pox were not detected in time due to lack of access to medical facilities. New waves and global expansion. In 2003, the United States experienced an unexpected and bizarre outbreak of the M.pox virus. This was the first time the virus was officially identified outside the African continent. The source of this outbreak was infected rodents imported from Ghana and sold as pets. These rodents transmitted the virus to domestic dogs, and then the owners of these dogs contracted the disease. This incident not only made M.pox a more serious global threat, but also showed that the transmission of this virus can easily and quickly spread beyond continental borders due to the global animal trade and increased international communication. The outbreak also highlighted the importance of stricter regulations on animal trade and animal health monitoring. Global efforts to control and contain the virus. With the passage of time and the increase in the number of M.pox cases detected around the world, the global health organizations took more measures to control and contain this virus. Widespread vaccinations, raising public awareness, and strengthening health infrastructure in vulnerable areas were among the measures taken to prevent further spread of the disease. Among the important measures was the promotion of vaccination against smallpox, as the smallpox vaccine was recognized as an effective tool in preventing M.pox. Although public vaccination against smallpox had been discontinued in many countries, the vaccine became available again in areas where M.pox outbreaks had become a concern. Lessons from the history of the M.pox virus. One of the most important lessons to be learned from the history of M.pox virus is that new diseases and viruses can emerge from anywhere at any time. Global communications, animal trade, and environmental change are all factors that can contribute to the spread of emerging viruses. The history of M.pox shows that this virus, although it may initially appear to be a local problem in certain regions of Africa, has the potential to become a global threat. This issue not only shows the importance of studying and researching emerging viruses, but also emphasizes the need for stronger health infrastructure and better preparedness to deal with possible future outbreaks. As we saw with the history of the M.pox virus, knowing the past can help us better understand the future and prevent what might happen. So, stay with us on this scientific and informative journey so that with more information that will be presented in the next chapters, we can deal with this global threat more effectively. Chapter 3. Where and how did it form? The story of the M.pox virus and how it came to be is as scientific and medical as it is complex and multi-layered to the point of being a historical and biological mystery. In its reality, this virus represents the complex interactions between animals, humans, and the environment. Understanding how this virus is formed will help us understand the reasons for its spread, and maybe we can prevent it from spreading further. Sources of the virus. M.pox virus belongs to the Poxviridae family of viruses, which includes other viruses such as the smallpox virus, variolavirus. These viruses are generally known for their highly infectious capabilities and have a long history of deadly outbreaks in human societies. But unlike the smallpox virus, which specifically infected humans, the M.pox virus was first identified in wild animals, especially rodents and monkeys. The primary origin of M.pox virus can be traced to the tropical and subtropical ecosystems of Africa. In these areas, a variety of wild animals live, many of which can serve as natural hosts for various viruses. Genetic studies have shown that rodents, especially a type of squirrel native to Africa, are known to be one of the most important early hosts of the virus. These squirrels have been in direct contact with humans due to living near human habitats and also because of hunting them for meat consumption. Direct contact with the blood or infected tissues of these animals, or even consuming their uncooked meat, can cause the virus to be transmitted to humans. This has caused the M.pox virus to remain an endemic disease in rural areas of Africa. Routes of transmission from animals to humans. M.pox virus transmission routes from animals to humans are mainly through direct contact with infected animals. This contact can include hunting wild animals, eating their meat, or even coming in contact with their blood or other secretions. This type of transmission occurs mostly in rural communities and forested areas where people hunt wild animals for food. But this is not the only way to transmit the virus. Some studies have shown that M.pox virus can also be transmitted through respiratory secretions, although this type of transmission is much less common. In a situation where a person is in close and long-term contact with an infected animal or even an infected human, there is also a possibility of transmission of the virus through the air. This type of transmission, although rare, can lead to the spread of the virus in small communities and even among members of the same family. The role of environmental changes. Environmental changes have also played an important role in the formation and spread of M.pox virus. Deforestation, climate change, and the expansion of human habitats into forested areas can all lead to increased contact between humans and wild animals. These environmental changes have caused humans to be in contact with animals that are the natural hosts of viruses more than before. For example, in some areas of Central Africa, deforestation for various reasons such as agriculture and urbanization has reduced the habitats of wild animals. This has caused animals to migrate to areas closer to human settlements, and as a result, the possibility of encountering and direct contact with humans increases. These contacts can lead to the transmission of the virus from animals to humans and then to its spread among human communities. The role of local markets. Another factor that plays a role in the transmission of M.pox virus from animals to humans is local markets. In many African countries, local markets are known as places where a variety of wild animals are sold for consumption. These markets, sometimes known as bushmeat markets, provide an ideal environment for the transmission of animal viruses to humans. In these markets, wild animals are hunted from the forests and sold alive or even slaughtered. Close contact between humans and animals, especially in unsanitary conditions, can easily lead to the transmission of various viruses. This explains why many of the early cases of M.pox were reported near areas where local markets were active. The role of culture and customs. Local culture and customs can also play a role in the spread of M.pox virus. In some rural communities in Africa, hunting wild animals and consuming their meat is considered a part of local culture and traditions. These cultures and customs, although not negative in themselves, can contribute to increasing the likelihood of transmission of viruses if there is insufficient awareness of health risks. For example, in some societies, hunting monkeys is considered a common practice to provide meat. Considering that monkeys can act as hosts of M.pox virus, this action can directly lead to the transmission of the virus to humans. In these areas, raising awareness and educating local communities about the health risks of hunting and consuming wild animal meat can help reduce cases of M.pox. The effect of the spread of other diseases. It is not possible to understand how M.pox virus formed and spread without considering the outbreak of other diseases that occurred during the same period or before. For example, the HIV/AIDS outbreak in Africa, which created one of the world's greatest health crises, can be studied as an example of the impact of other diseases on the spread of M.pox. By weakening the body's immune system, the AIDS virus can lead to an increase in people's sensitivity to other infections. In areas where the M.pox virus is common at the same time as the spread of AIDS, people with AIDS may get more M.pox due to a weak immune system, and this issue can help the spread of this virus. Evolution of the virus. One of the most important aspects of how the M.pox virus was formed is its evolution. Viruses are not living organisms, but they have the ability to reproduce and undergo genetic mutations that can make them more resistant to new environmental conditions and even vaccines. M.pox virus is no exception to this rule. Research has shown that the M.pox virus is constantly changing and evolving. This evolution can lead to increased resistance of the virus to drugs or vaccines, thus making it more difficult to control and contain. For this reason, further study and research on the genetic evolution of this virus can help to develop more effective methods to deal with it. Understanding these factors can help us find more effective ways to prevent the spread of this virus and prevent it from spreading to new areas. In the following chapters, we will examine the ways of transmission of the M.pox virus, as well as methods of prevention and protection against it. Join us to continue this scientific journey, and with more information, we can protect our health and our society against this global threat. Chapter 4: Ways of transmitting the M.pox virus. Due to its specific characteristics, M.pox virus has different ways of transmission, all of which are somehow related to direct or indirect contact with the source of infection. In this chapter, we will examine these ways of transmission and the effective factors in the spread of the virus. Also, we examine the role of human and environmental behaviors in increasing or decreasing the risk of transmission of this virus. Direct contact with infected animals. One of the most important and well-known ways of M.pox virus transmission is direct contact with infected animals. This contact can include contact with blood, saliva, nasal secretions, or even the skin of animals infected with the virus. As mentioned in previous chapters, rodents and monkeys are among the main hosts of this virus. Humans who live in rural areas of Africa and come into contact with wild animals are most at risk of contracting the virus. In these areas, the hunting of wild animals for food, especially rodents and monkeys, can be considered as one of the main factors of transmission of the virus to humans. Also, contact with the skin or meat of infected animals without observing hygiene precautions can lead to the transmission of the virus. These types of contacts often occur in situations where people are not sufficiently aware of the health risks caused by these types of behaviors. Human-to-human transmission. Although animal-to-human transmission of M.pox is the most common route of transmission, human-to-human transmission is also possible. This type of transmission occurs mainly through close and direct contact with an infected person. Contact with body secretions of an infected person, such as saliva, nasal secretions, or even fluids from skin lesions, can lead to virus transmission. In some cases, the virus can also be transmitted through airborne particles. This type of transmission may occur especially in closed and crowded environments, such as hospitals or crowded homes. Although this type of transmission is less common, it can quickly lead to an outbreak due to its ability to spread more in closed environments. Another way of transmission of M.pox virus from human to human is indirect contact. This contact can take place through the shared use of personal items such as towels, clothes, or beds of the infected person. In this situation, the virus can survive on the surface of these objects for a period of time and be transmitted to a healthy person if they come in contact with them. This type of transmission can help spread the disease, especially in situations where public health is poor. The role of transmission in human societies. Human behaviors play an important role in the spread of M.pox virus. In communities that routinely come into contact with wild animals or use their meat for food, the risk of transmission of the virus is higher. Also, in situations where public hygiene is poor and close contact between people is common, transmission of the virus occurs rapidly. One of the important factors in virus transmission is travel and movement of people between different regions. When people travel from areas where the disease is common to other areas, they can carry the virus with them and transfer it to new areas. This issue has become more important, especially in the modern era and with the increase of international travel. M.pox virus can easily be transmitted from a rural area to urban areas and then to other countries, especially if infected people travel without being properly diagnosed. The role of environmental and climate changes. Environmental and climatic changes can also contribute to the spread of M.pox virus. Deforestation, expanding urbanization, and climate change can lead to increased contact between humans and wild animals. These changes cause wild animals to migrate to areas closer to human settlements, and as a result, the possibility of virus transmission to humans increases. Also, climate changes can lead to changes in animal habitats and changes in their migratory behaviors. This could lead to the introduction of virus-carrying animals into new areas where they were not previously present, thus putting new communities at risk. Rising temperatures and changes in rainfall patterns can also lead to increased populations of rodents and other animals that carry the virus, which in turn increases the risk of the virus spreading. Virus transmission through food. Another possible way of transmission of M.pox virus is through consumption of contaminated food. Consumption of wild animal meat that is not properly cooked or consumed raw can lead to the transmission of the virus to humans. This is especially important in rural areas of Africa where the consumption of wild meat is common as a major food source. Informing and educating local communities about the health risks of consuming wild meat and the importance of cooking it thoroughly can help reduce cases of M.pox. Also, creating strict laws and regulations in the field of hunting and selling wild meat can play an important role in preventing the transmission of the virus. Potential for widespread outbreaks. M.pox virus has the potential to spread widely due to its high transmission and spread capabilities. In situations where public health is poor and close contact between people is common, the virus can spread quickly from person to person and lead to a widespread outbreak. Also, due to the ability of the virus to be transmitted through contact with wild animals, as well as human-to-human transmission, there is a possibility of its spread in different communities. One of the biggest concerns about the M.pox virus is the possibility of its spread in urban and densely populated areas. In these conditions, the virus can be transmitted rapidly through close contact between people, sharing personal items, and even through airborne particles. This can lead to a large outbreak that is difficult to control and requires immediate and extensive measures. Understanding these routes of transmission and educating at-risk communities can help reduce the spread of this virus and protect public health. In the following chapters, we will examine methods of prevention and protection against the M.pox virus, as well as international responses to the threat of this virus. This knowledge helps us to protect ourselves and our society against this global threat with adequate information and proper preparation. The fifth chapter, Methods of Preventing the Transmission of M.pox virus. Prevention of M.pox transmission is one of the most important issues to be addressed due to its potentially serious consequences. In this chapter, various methods that can help reduce the risk of contracting this virus are discussed. These methods include individual, community, and international actions that can play an effective role in preventing the spread of this disease. Public awareness and education. One of the first steps in preventing the transmission of M.pox virus is to inform people about this virus and the ways of its transmission. Many people living in high-risk areas may not be aware of the virus or its dangers. Educating local communities about how the virus is transmitted, the early symptoms of the disease, and what they can do to protect themselves and their families will go a long way in reducing cases. Education programs can include distributing brochures, holding workshops, and using local media to convey health messages. Also, schools and educational institutions can help increase the level of public awareness by providing accurate and practical information to students and their families. Accurate understanding of how the virus is transmitted and knowledge of prevention methods is the first and most important step in preventing the widespread spread of the disease. Personal and social health. Observance of personal hygiene is one of the simplest and most effective ways to prevent M.pox virus. Frequent hand washing with soap and water for at least 20 seconds, especially after contact with animals or environments where the virus is likely to be present, can significantly reduce the risk of transmission. Using alcohol-based disinfectants can also be effective when there is no access to soap and water. In addition, environmental hygiene is also very important, especially in areas where there is a possibility of wild animals or rodents. Cleaning the living environment and preventing animals from entering homes can help reduce the risk of infection. Also, sanitary disposal of waste and preventing their accumulation in the environment can prevent the attraction of wild animals and rodents to residential areas. Avoid contact with wild animals. One of the most important ways to prevent transmission of M.pox virus is to avoid contact with wild animals, especially rodents and monkeys. These animals are known as the main hosts of the virus, and contact with them can increase the risk of infection. In areas where these animals exist widely in nature, one should refrain from approaching them and also from hunting or consuming their meat. Although these recommendations may be challenging for some rural communities that depend on hunting and consumption of wild meat, raising awareness of the health risks of this type of contact and providing suitable food alternatives can help reduce these risks. Also, if it is necessary to contact wild animals due to work or living conditions, it is necessary to use protective equipment such as gloves and masks. Rodent control and monitoring. One of the important measures in preventing the transmission of M.pox virus is to control and monitor the rodent population. These animals are not only known as hosts of the M.pox virus, but can also transmit the virus to other animals and finally to humans. Rodent population control through preventive measures such as the use of traps, preventing their access to food sources, and sanitary disposal of waste can play an important role in reducing the risk of infection. In addition, regular monitoring of rodent populations and checking them for the presence of the virus can help in the early detection and control of virus outbreaks. Conducting periodic tests on rodents in high-risk areas and implementing health measures in case of virus detection can prevent the spread of the disease to humans. Immunization and vaccination. Although there is currently no widespread vaccination against M.pox virus, research is underway to develop effective vaccines. The use of existing vaccines, such as the smallpox vaccine, which has been shown to be partially effective against M.pox virus, may be used as a preventive measure. In areas where outbreaks of M. pox virus have been reported, immunization of the population, especially those at higher risk, can help reduce cases. Also, continuing research and development of new vaccines specifically designed for M.pox virus is one of the important priorities in dealing with this virus. Financial and scientific support for this research can help control and even eradicate this disease in the long run. Quarantine and border control. In case of an M.pox virus outbreak in a region, quarantine of infected people and border control are among the measures that can prevent the spread of the disease to other regions. These measures include travel restrictions, health checks at points of entry and exit, and enforcement of strict rules to prevent the virus from spreading to other areas. In addition, the establishment of temporary quarantine centers for people who have been in contact with wild animals or who have entered from high-risk areas can help to identify cases early and prevent the spread of the virus. These centers must be equipped with appropriate medical equipment and expert staff so that they can effectively prevent the spread of the virus. Emphasis on international cooperation. Dealing with the M.pox virus and preventing its spread requires extensive international cooperation. Countries should share information about the spread of the virus with each other and cooperate in the field of scientific research and development of vaccines. Also, it is important to support developing countries that may not have adequate health infrastructure to deal with this disease. The creation of international organizations and institutions specifically designed to deal with infectious and emerging diseases such as M.pox can help coordinate global action. These organizations must have the ability to respond quickly to the spread of the virus and be able to send the necessary resources and expertise quickly to the areas affected by the disease. Conclusion: M.pox virus prevention requires a comprehensive and multidimensional approach that includes public education, personal hygiene, rodent control, immunization, quarantine, and international cooperation. Understanding the importance of these measures and their strict implementation can help reduce the risk of infection and prevent the spread of the virus. In the next chapter, we will examine how this virus can become a global epidemic and the necessary measures to prevent this scenario. Chapter 6. How does the M.pox virus turn into an epidemic? Viral epidemics have always been recognized as one of the serious threats to public health and human societies. M.pox can become a major epidemic due to its unique transmission capabilities and potential to cause widespread disease. In this chapter, we will examine the effective factors in turning the M.pox virus into an epidemic, the possible trends of its spread, and the necessary measures to prevent such a scenario from happening. Ability to transmit the virus. One of the key factors in turning a disease into an epidemic is the ability to transmit the virus from one person to another. M.pox virus is transmitted through direct contact with body secretions, fluids, or surfaces contaminated with the virus. This type of transmission can happen quickly, especially in communities where access to proper sanitation and medical equipment is limited. For this reason, controlling and limiting transmission routes is one of the most basic measures to prevent this virus from becoming an epidemic. M.pox virus is also transmitted through respiratory droplets, especially if infected people are in closed and crowded environments. This feature makes the virus spread much faster in environments such as shared homes, shelters, and public places. Transmission through animals is also another possible route that should be seriously considered. Epidemiological trends. To better understand how M.pox virus turned into an epidemic, we need to examine its epidemiological trends. These trends include temporal and spatial patterns of disease spread, virus reproduction rates, and vulnerability of different communities. The virus reproduction rate, R0, is one of the most important indicators that show how many other people an infected person can transmit the virus to. If this index is higher than 1, the probability of the virus becoming an epidemic increases. In areas with high population density, such as large cities, the virus can spread much faster. This issue is due to the proximity of people to each other, the common use of public transportation, as well as closer contacts in work and social environments. These conditions, along with the lack of widespread vaccination and non-compliance with health protocols, can lead to the transformation of a local disease into a major epidemic. Lack of health infrastructure. One of the most important factors in turning a disease into an epidemic is the state of health infrastructure. In areas where access to health services is limited, early identification and control of cases may be delayed. This allows the virus to spread unhindered through the population and quickly become a public health crisis. Also, the lack of medical resources such as hospital beds, protective equipment, and experienced medical staff can quickly lead to an increase in severe cases and deaths. This situation is especially severe in developing countries and regions facing economic and social crises. In such a situation, even a small wave of cases can quickly turn into a major epidemic. The role of population movements and migration. Population movements and immigration are also one of the factors that can help spread the M.pox virus and turn it into an epidemic, especially in areas where people are forced to relocate due to war, economic crisis, or climate change. The transmission of the virus to new areas is very likely. These movements can carry the virus to areas not previously affected by the disease and create new waves of epidemics. In addition, internal and external migration can increase contact between people from different regions and allow the virus to spread to new areas. This issue becomes especially important when there are not enough health controls at the borders and points of entry, and infected people travel to other areas without being identified. In such a situation, the speed of the spread of the virus can increase dramatically. The role of media and misinformation. In today's world, the media and the information published through them play an important role in shaping public opinion and social behavior. In times of health crises, misinformation or rumors can lead to public panic and encourage irrational and harmful behavior in society. These behaviors can include impulse purchases, refusal to follow hygiene protocols, and even unnecessary migration, all of which contribute to the further spread of the virus. In addition, misinformation may cause people to refuse to receive vaccines or appropriate treatments, which could lead to an increase in cases and the spread of the virus. Therefore, careful control and management of information published in the media, especially in social networks, is very important in preventing a disease from becoming an epidemic. International cooperation and the role of international organizations. One of the key strategies in preventing the M.pox virus from becoming a global epidemic is international cooperation. The countries of the world must share information about the spread of the virus quickly and transparently with each other. This information can include epidemiological data, results of clinical trials, and successful experiences in disease control. In addition, international organizations such as the World Health Organization, WHO, play an important role in coordinating these collaborations and providing necessary guidance to different countries. These organizations must be able to quickly respond to areas facing virus outbreaks and provide the necessary resources to control the disease. These resources include medical equipment, expert staff, and financial and technical support that can help control the virus and prevent it from becoming an epidemic. The role of governments in controlling the virus. Governments at the national level also play an important role in preventing M.pox virus from becoming an epidemic. Applying strict health laws and regulations, implementing extensive vaccination programs, and providing accurate and timely information to the public are among the main duties of governments in the face of this virus. Also, governments should strengthen the health infrastructure by allocating sufficient financial resources and prepare to face possible epidemic waves. In critical situations, governments may need to impose social restrictions such as regional quarantines, travel restrictions, and closing public places. These measures, although they may face negative social reactions, are very effective in preventing the rapid spread of the virus and maintaining public health. Conclusion: the transformation of M.pox virus into a global epidemic depends on a complex set of factors, including the transmissibility of the virus, the state of health infrastructure, population movements, misinformation, and the role of governments and international organizations. Understanding these factors and adopting comprehensive and coordinated approaches at the national and international level can prevent the occurrence of a large epidemic. In the next chapter, we will examine personal and social protection strategies against the M.pox virus. Chapter 7: How to protect ourselves from the M.pox virus. M.pox virus can be a serious threat to public health due to its potential capabilities to transmit and cause disease. For this reason, it is very important to know effective methods to protect yourself and others from this virus. In this chapter, we will take a closer look at the practical and scientific solutions to prevent the transmission of M.pox virus and protect ourselves against it. 1. The importance of personal hygiene. One of the most important and simple ways to prevent the transmission of the M.pox virus is to observe personal hygiene. Washing hands regularly using soap and water for at least 20 seconds is one of the main ways to prevent the transmission of viruses from surfaces to the body. If you don't have access to soap and water, using alcohol-based hand sanitizers with at least 60% alcohol can also be effective. Observance of social distancing, especially in public and crowded places, is also very important. Keeping a distance of at least 1.5 meters from others helps to reduce the possibility of transmission of the virus through respiratory droplets. Also, wearing a mask indoors and in public is recommended as an extra protective measure, especially if you live in an area with a high prevalence of M.pox virus. 2. Avoiding direct contact with infected people. M.pox virus is transmitted through direct contact with the skin or bodily secretions of an infected person. Therefore, it is very important to avoid close contact with people who have symptoms or have recently been infected with M.pox virus. These contacts can include shaking hands, hugging, or touching surfaces and objects that have been touched by the infected person. If one of your family members or colleagues is infected with the M.pox virus, it is better to avoid getting close to them and, if possible, quarantine the infected person in a separate room. Also, sharing personal items such as towels, clothes, and eating utensils with an infected person increases the risk of virus transmission and should be strictly avoided. 3. The role of vaccination. Vaccination is one of the most effective tools to prevent viral diseases such as M.pox. If an effective M.pox vaccine is available, receiving it can significantly reduce the risk of developing the disease. By strengthening the body's immune system, vaccines help it to respond quickly and effectively when confronted with a virus. In addition to individual vaccination, community immunization is also important. When a high percentage of the population is vaccinated, the chance of the virus spreading is dramatically reduced. This situation, called herd immunity or herd immunity, can also protect vulnerable people who cannot get the vaccine. 4. Awareness and education. Knowing the symptoms, ways of transmission, and how to prevent M.pox virus is key to protecting yourself and others. Public education, especially in schools, workplaces, and communities, can help slow the spread of the virus. Providing correct and up-to-date information through media and social networks also plays an important role in increasing public awareness. One of the most important points in public education is to emphasize early identification and diagnosis of disease symptoms. The faster people recognize the symptoms and seek medical advice, the more likely it is to control and contain the disease. Also, Educating people on how to use masks correctly, observing personal hygiene, and the importance of vaccination can have a significant impact on reducing the spread of the virus. 5. Stress management and mental health. Along with protecting physical health, attention to mental health is also necessary. Outbreaks of viral diseases can cause fear and stress in people, which, if not managed, can negatively affect the immune system. Managing stress through deep breathing exercises, meditation, and regular exercise can help maintain mental health and improve immune system function. Additionally, having a strong support network of family and friends, as well as access to psychological counseling when needed, can help manage stress and anxiety better. Misinformation and rumors can also exacerbate stress, so it's important that people get their information from reliable sources and avoid spreading false information. 6. Preventive measures in the workplace and public places. Workplaces and public places can become centers of virus transmission due to the high number of people present in them. For this reason, compliance with health protocols is particularly important in these places. Employers must take appropriate measures to ensure the health of their employees, including providing hand-washing facilities, disinfecting high-contact surfaces, and encouraging social distancing. Also, in public places such as stores, restaurants, and public transportation, installation of hand sanitizers and use of masks should be observed as a health standard. Implementing regular cleaning and disinfection programs in these places can also help reduce the possibility of virus transmission. 7. Management and quarantine of people suspected of being infected. If you or a member of your family has M.pox virus or is showing symptoms, the best course of action is to self-quarantine and distance yourself from others. This action not only helps protect other people, but also gives you time to recover without the stress and worry of spreading the virus to others. During the quarantine period, it is necessary to follow medical advice, take prescribed medications on time, and observe your personal hygiene carefully. Also, it is better to avoid close contact with other people and use protective equipment such as masks and gloves. 8. Immediate actions if symptoms are observed. Knowing the early symptoms of M.pox virus and taking immediate action if you see these symptoms can help prevent the spread of the virus. These symptoms may include fever, headache, muscle pain, and skin rash. If you see any of these symptoms in yourself or others, it is better to go to a medical center immediately and do the necessary tests. If the test result is positive, follow-up and proper medical care, along with home quarantine or hospitalization, if needed, is necessary. Also, affected people should carefully follow medical recommendations and avoid arbitrarily taking drugs or using invalid treatment methods. Conclusion: protecting yourself against M.pox requires a series of preventive measures, including personal hygiene, vaccination, public education, and stress management. By observing these principles and public cooperation at the community level, it is possible to prevent the virus from spreading and turning it into an epidemic. In the next chapter, we will examine whether the M.pox virus epidemic could be more dangerous than the global corona epidemic or not. Chapter 8. Could the M.pox epidemic be more dangerous than the global coronavirus epidemic? Since the outbreak of the coronavirus in 2019, the world has faced one of the biggest health crises in its history. This virus not only killed millions of people, but also severely affected people's daily life, global economy, and social structures. Now that the M.pox virus has also been raised as a potential threat, the question has formed in the minds of many people that this virus can be as dangerous as or even more than the coronavirus. In this chapter, we will explore this question and examine the factors that may have caused the M.pox virus to become a bigger epidemic than the coronavirus. 1. Virus transmission speed. One of the most important factors that can determine the dangerousness of a virus is the speed of its transmission from one person to another. The coronavirus spread very quickly around the world because the virus is easily transmitted through respiratory droplets, and infected people can transmit the virus to others even before symptoms appear. On the other hand, M.pox virus is transmitted mainly through direct contact with the skin or body secretions of infected people. Although this method of transmission can also lead to rapid spread of the disease, it is less widespread than airborne transmission. This means M.pox is less likely to spread as quickly as the coronavirus, but that doesn't mean it's less dangerous. One of the remarkable points about the M.pox virus is that people with this virus can keep the virus in their body for a long time and transmit it to others. This feature, especially in situations where people are not diagnosed in time or not properly quarantined, can contribute to the further spread of the disease. 2. Severity of symptoms and mortality rate. The severity of symptoms and the death rate of M.pox virus is also one of the important factors in evaluating its dangerousness. The coronavirus quickly became recognized as a serious threat to public health because it caused severe symptoms in many people, including severe breathing problems and acute respiratory syndrome. The high death rate of corona, especially in the elderly and those with underlying diseases, was one of the main reasons for global concerns. In contrast, the M.pox virus has different symptoms that may include skin rash, fever, headache, and muscle pain. Although some cases of infection with this virus can lead to serious complications and even death, in many cases, the symptoms are relatively mild and the fatality rate is low. This could indicate that the M.pox virus is less dangerous than the coronavirus, but it should not be underestimated. One of the concerns about M.pox virus is the possibility of long-term complications after recovery from the disease. Some people may still have skin problems or other side effects after recovery that can affect their quality of life. 3. Answer of the World Health System. The response of global health systems to the outbreak of diseases plays an important role in their control and containment. In the case of the coronavirus, many countries faced delays in responding to the initial outbreak, which contributed to the rapid spread of the virus. Lack of medical equipment, manpower, and financial resources were also other factors that made disease control more difficult. On the other hand, according to the past experiences of dealing with the coronavirus, the global health systems are now better prepared to deal with new viruses such as M.pox. Vaccination, quarantine, and compliance with health protocols are among the measures that can help slow the spread of the virus. However, other challenges such as the inequitable distribution of vaccines and health facilities in poorer countries can still hinder effective control of the epidemic. Also, international cooperation and exchange of information between countries is also very important. If countries share timely and correct information about M.pox outbreaks, the possibility of faster and more effective control of this disease will be higher. These collaborations include the exchange of scientific information, medical equipment, and financial support for countries that may face a large outbreak of the virus. 4. Social and cultural factors. Social and cultural factors can also play an important role in the spread of M.pox virus. In some communities, false beliefs and rumors can lead to non-observance of health protocols and, as a result, an increase in the spread of disease. For example, during the corona epidemic, many people refused to get vaccinated or practice social distancing due to misinformation, which helped spread the virus further. In the case of the M.pox virus, public awareness and proper education can help reduce these types of problems. Using the media, social networks, and educational campaigns to provide accurate information and prevent the spread of rumors can help protect society from this virus. Also, understanding cultural differences and presenting health messages in a way that is in harmony with the values and beliefs of the society can have a positive effect in dealing with the disease. 5. Economic and social effects of the epidemic. Another factor that can help to compare the M.pox virus epidemic with the corona epidemic is their economic and social effects. The corona epidemic was accompanied by widespread shutdowns, reduced economic activity, and widespread unemployment around the world. This economic crisis is still felt in many countries, and full recovery from it may take years. In the case of the M.pox virus, although its economic and social effects are not yet fully known, it can be predicted that if the virus becomes a major epidemic, it could have similar effects. For example, there may be a need to reopen businesses, travel restrictions, and reduced economic activity, which could lead to increased economic and social pressures. 6. The role of medical innovations. Medical and therapeutic innovations also play an important role in determining the dangerousness of an epidemic. During the corona epidemic, the rapid development of vaccines and new treatments helped to reduce the severity of the crisis. Also, extensive scientific research in the field of virology and immunology helped to better understand this virus and methods to deal with it. In the case of M.pox virus, scientific research is still ongoing, and new treatment methods and effective vaccines may be developed to deal with this virus in the near future. These innovations could help reduce the risk of an epidemic and make M.pox a less serious threat. However, the success of these innovations depends on equitable access to these technologies and treatments worldwide. If poorer countries cannot access these resources in time, the possibility of the virus spreading and becoming a global epidemic increases. Conclusion. Ultimately, the answer to the question of whether the M.pox virus could be more dangerous than the coronavirus depends on a number of factors. Although the M.pox virus may not be as widespread and deadly as the coronavirus, it should not be underestimated. Health system preparedness, public awareness, and international cooperation play a vital role in controlling this virus and preventing it from becoming a global epidemic. In the next chapter, we will examine the symptoms that, if observed, should be seen by a doctor immediately to ensure that M.pox virus is infected and to take the necessary measures for faster treatment. Chapter 9. What symptoms should make us go to the doctor? In any infectious disease, knowing the early symptoms and timely diagnosis can have a significant impact on the success of the treatment and prevention of the spread of the disease. In the case of M.pox virus, accurate recognition of the symptoms and timely response if these symptoms are observed can help control the disease and reduce its effects. This chapter examines the symptoms of M.pox virus and key points for timely diagnosis and immediate action if symptoms are observed. 1. Early symptoms of M.pox virus. M.pox virus can cause a variety of symptoms, some of which are similar to other viral diseases. These symptoms usually appear within 1 to 2 weeks of exposure to the virus and may include skin rashes. One of the obvious symptoms of M.pox virus is skin rashes. These rashes usually appear as red, swollen spots on the skin that may turn into small, pus-filled sores. These rashes may start in certain areas of the body and then spread to other areas. Fever. High fever is one of the common symptoms of M.pox virus. This fever can last for several days and is accompanied by a feeling of weakness, chills, and sweating. Headache and muscle pain. Severe headache and muscle and joint pain may also be symptoms of M.pox virus. These pains can be extremely annoying and affect daily activities. Fatigue and general weakness. Severe fatigue and general weakness are other common symptoms that can be caused by the effect of the virus on the body's immune system and metabolic processes. 2. Advanced symptoms and complications. In some cases, the M.pox virus can cause more severe complications and more advanced symptoms. These symptoms may include secondary infections due to damage to the skin and immune system, patients may get secondary bacterial infections. These infections can worsen symptoms and complicate the patient's condition. Respiratory problems. Although respiratory problems are not directly one of the primary symptoms of M.pox virus, in some cases, the affected person may face breathing problems, especially if the disease progresses widely and severely. Eye problems. Skin rashes may also spread to areas near the eyes and cause eye problems and corneal inflammation. This condition can lead to vision disorders and other eye problems. Skin complications. In some people, skin rashes may lead to permanent scars or skin changes that can affect the appearance and health of the skin. 3. Key points for timely diagnosis. For timely identification and appropriate action against the symptoms of M.pox virus, it can be useful to pay attention to the following points. Contact tracing. If you or someone close to you has recently been in contact with someone who has symptoms similar to M.pox virus, it is important to carefully check the symptoms and see a doctor if necessary. Monitoring of symptoms. In case of initial symptoms such as fever, skin rash, and headache, you must monitor your condition closely and continuously. If symptoms worsen or do not improve, see a doctor immediately. Refer to medical centers. If you see more advanced symptoms such as respiratory problems, secondary infections, or significant changes in the skin, you should visit a specialized medical center. These centers can perform the necessary tests and provide appropriate treatments. 4. Immediate actions if symptoms are observed. If you notice the symptoms of M.pox virus in yourself or others, it is better to take the following immediate actions. Medical advice. Call a doctor or health center immediately and report your condition. The doctor can make a more accurate diagnosis and provide an appropriate treatment plan. Self-isolation. Until the results of the tests are known, it is better to isolate yourself from others and follow hygiene measures such as wearing a mask and observing personal hygiene carefully. Knowledge of the treatment process. If you are diagnosed with M.pox virus, you must follow the doctor's treatment and medication instructions carefully. This includes taking medications on time and following health protocols. 5. The importance of follow-up and care. Continuous follow-up and careful care of the health condition can help to recover faster and reduce the complications of the disease. Also, being aware of the symptoms and seeing a doctor on time can play a key role in preventing the spread of the virus to others. According to these points, it can be said that early identification and quick action against the symptoms of M.pox virus are very important. These measures can help reduce the severity of the disease, prevent side effects, and prevent a wider outbreak. Chapter 10. The death rate caused by this virus. The probability that the M.pox virus will cause as many deaths as the corona epidemic, COVID-19, depends on several factors. Currently, based on the available information, the comparison between these two viruses and the assessment of their risk potential is related to the following. 1. Features of M.pox virus compared to corona. Speed of transmission. M.pox virus is generally less contagious than the coronavirus. While the coronavirus is transmitted quickly through respiratory droplets and close contact, M.pox transmission occurs mostly through direct contact with skin rashes and body fluids. This difference in transmission methods can affect the severity of the outbreak and spread of the virus. Severity of the disease. The symptoms of the M.pox virus are generally milder than those of the coronavirus, and the disease occurs mostly in its mild forms. However, severe complications and secondary infections can cause serious problems, especially in people with weakened immune systems. Existence of vaccine and treatment. For the coronavirus, effective vaccines and treatments have been developed that have helped to reduce the death rate and severity of the disease. In the case of M.pox, vaccines and specific treatments are not yet available, and this can affect the risk of mortality. 2 factors affecting the risk of mortality. Healthcare system. The quality and capacity of healthcare systems in countries play a key role in managing and reducing mortality. Countries with strong health infrastructure and the ability to detect and treat diseases in time are usually able to control epidemics and reduce mortality. Awareness and prevention. Public awareness and the implementation of preventive measures such as personal hygiene and the use of protective equipment can help reduce the transmission of the virus and prevent its wider spread. Also, preventive measures such as isolating infected people and following health protocols can have a significant effect on reducing mortality. Global response and international cooperation. Global response to epidemics and international cooperation to exchange information and health resources can help reduce the risk of mortality. Quick and timely information about the disease and coordinated response between countries can play an important role in controlling epidemics. 3. Forecast and current situation. Based on the available information, M.pox probably won't cause as many deaths as the coronavirus, but that will definitely depend on the specifics of the virus and how it's managed. Despite this, it is very important to pay attention to the prevalence and characteristics of this virus and prepare for a quick and effective response to it. Finally, careful monitoring of disease outbreak trends, scientific research and development of effective vaccines and treatments, and international cooperation can help reduce the risk of mortality and control future epidemics. Currently, continuous monitoring and awareness of the health status and prevention of wider spread of diseases can help to maintain public health and reduce the risks caused by viruses. The final part and conclusion. At the end of this book, our main goal has been to provide you with a comprehensive and in-depth view of M.pox virus and share essential information about its prevalence, prevention, and management. M.pox virus, despite similarities to other viral diseases, has its own characteristics and risks, which accurate knowledge can play an important role in dealing with this health threat. 1. The importance of awareness and education. Public awareness and proper education about M.pox virus and other similar diseases is one of the key tools in preventing and controlling their spread. By fully understanding how it is transmitted, symptoms, and prevention methods, you can take the necessary steps to protect yourself and others. These trainings should include information about early symptoms, prevention methods, and necessary actions if symptoms are observed. Also, proper and timely information through the media and health campaigns can help raise awareness and reduce public concerns. By having accurate and scientific information, people can make better decisions and implement more effective strategies in the face of health threats. 2. Preventive and health measures. Prevention of transmission of M.pox virus and control of its spread requires compliance with health protocols and preventive measures. These measures include observing personal hygiene, using protective equipment such as masks, and observing social distancing. Also, knowing the correct methods of washing hands and cleaning the environment can also help reduce the risk of virus transmission. Isolation of infected people and timely diagnosis of the disease play a key role in preventing further spread of the virus. By carefully and regularly implementing these measures, M.pox virus can be prevented from becoming a bigger global epidemic. 3. The importance of international cooperation. In dealing with global threats such as the M.pox virus, international cooperation and information exchange between countries is particularly important. Global and national health organizations must act in a coordinated manner and provide the necessary information and resources to the countries that need them. These collaborations include the exchange of experiences, scientific research, and the provision of health resources that can help combat the disease more effectively. Also, supporting countries with limited resources and building stronger health infrastructure in these countries can help increase their ability to deal with disease outbreaks. This type of global cooperation can lead to reducing health inequalities and improving the level of global health. 4. The role of medical research and innovation. Scientific research and medical innovations play an important role in identifying and treating viruses. The development of vaccines, drugs, and new treatments can help control and prevent diseases. In the case of M.pox virus, continued research is necessary to better understand the characteristics of the virus and develop effective treatments. Also, creating research networks and investing in scientific projects related to infectious diseases can help speed up the process of developing treatments and vaccines. These measures can help strengthen preparedness to face future health threats and increase scientific and medical capabilities at the global level. 5. Social and psychological effects. Outbreaks of infectious diseases can have profound social and psychological effects on societies. Stress, anxiety, and health concerns are among the psychological consequences that may increase as a result of disease outbreaks. In addition, the economic and social effects caused by the epidemic can affect the daily life of individuals and communities. To reduce these effects, it is important to provide psychological and social support to affected people and their families. Counseling and psychological support programs, especially in times of crisis, can help improve psychological and social status. Also, creating economic and social programs to reduce the negative effects of the epidemic on society can help strengthen resilience and improve the general situation. Finally, it can be said that M.pox virus, despite its specific characteristics, requires immediate attention and action to prevent it from becoming a bigger epidemic. By being fully aware of the symptoms, following health protocols, and international cooperation, we can help control and prevent this disease. Also, the importance of scientific research and medical innovation in the development of treatments and vaccines should not be overlooked. Finally, the effective management of infectious diseases requires a comprehensive and coordinated approach that includes preventive measures, research, and social and psychological support. With concerted efforts and global cooperation, effective countermeasures against viruses and promotion of public health can be achieved. By reading this book, we hope that you have acquired the necessary information and knowledge to deal with the M.pox virus and other similar diseases and have helped to empower yourself and others in the face of future health threats.